Kavod HaRav, it's a tremendous zechus to be here with you today, and I'm tremendously grateful on behalf of the Neve Family Institute and Enosh for the Rav taking your time today to discuss Brius and Nefesh with us.
My dear friend Dr. Freedman, it's always a pleasure to meet you, and it's not the first time we meet, and I think Klal Yisrael needs many more people like you that are professional psychiatrists, therapists, steeped in Torah and Yerushalayim. And we're all here to serve. I always say life is a mission, and we're here to serve and share whatever gifts HaKadosh Baruch Hu bestowed upon us. So I'll do my best to be helpful.
Thank you, Rav. I'm quite humbled. I think one of the main things that we're here to discuss today is within the Tehum of mental health. When we're dealing with people who are struggling with mental illness, when there are families who have a loved one who's dealing with mental health issues, how can we best prepare them for marriage, if appropriate, and how can we address this concept within Halacha?
When we speak about mental illness, people must be aware that we're speaking about a huge spectrum. Recently, I participated in the Chemet conference in Connecticut, which is an annual conference in which medical professionals come together with Rabbonim. And I attend this conference every year, and I had questions and answers and shiurim. And one of the topics they asked me to discuss is mental illness. And I said, it is like, so the heading was mental illness and halacha. And I said, it's like asking me to discuss physical illness and halacha. Physical illness means a million things. It could be from a devastating cancer to the common cold or a flu or a little blister on the tip of your finger. So mental illness goes from the most tragic cases of psychosis or neurosis to OCD to anxiety to so many different things. But we need to be aware, just like we've made huge progress in treating sickness and physical illness, we have made major strides in understanding mental illness and treating mental illness. I still think that we know far more about our bodies than we know about our brains or our minds. And the brain and the mind are not the same. And we still have so much more to learn about our neshamas, about our minds, but we know far more than we knew in the past. And I really think that most people that have emotional issues or mental issues with a proper preparation could get married and establish families. And they will need help along the way. And I think it is a challenge to understand how we can be most helpful to these people. So maybe let's get into more details.
Well, I think it's so important for young men and women in general to have an idea of when they are ready to take on the tremendous challenges and merits, of course, that come with marriage. Simply the responsibilities that come with it, both physically and emotionally, are tremendous challenges for everyone, how much more so for somebody who's struggled with a mental health issue. So I oftentimes will discuss with my patients about a need for stability before they will start to think about making changes in their life, whether that's changes in their work life, changes in yeshiva, changes in moving to a new community, and certainly changes whereby they'll be living with another person who will be expecting that they will be a healthy, functional member of society. So is there specific thoughts that the Rav has and guidance about when a person with a mental health issue would be ready to take on the challenges of marriage?
In every field of medicine, it's very difficult to be definitive. And many times I explain that Chazal and the great poskim, the great halachic rulers throughout the ages, never used numbers or percentage points. As long as they didn't have statistical sciences, they could not talk about numbers, but it is also deeper than that. So the human being is the most complex creature that HaKadosh Baruch Hu created in the world. And I think his nefesh is more complex even than his body. So, on one hand, Chazal teaches ben shmoynes lechuppah. Most people, even in the frumest community today, do not get married at the age of 18. So throughout the ages, we have realized that we're living in a changing world. And most people at such a ripe young age are not really ready to get married. And I use an expression, Hanach lebnei Yisrael, em lo neviim hem, b'nei neviim hem. And even though Chazal say ben shmoynes lechuppah, it's very interesting when the Rambam brings these halachas. The Rambam writes, ben shmoynes lechuppah, and then you have up to the age of 20. By 20, we expect you to find your Rad Ziving and get married. You're not bad with 20 bitla mitzvah say. But then the Rambam says if you're worried you can't learn Torah, then you have some more time, and he doesn't specify how much more time. In all the other mitzvahs, you're machayev a mitzvah when you become a bar mitzvah. Why would this mitzvah be an exception? It's not 13, it's 18. Going back hundreds of years, there were some gedolim that actually got married when they were 13. And the Shulchan Aruch writes that would be even better. Do you know anyone, any gadol, in our generation that get married when he was 13, or married off his children when they were 13? The answer is no. So obviously we're living in a changing world, and marriage is a huge challenge. It always was, but more so today. And therefore, as I said before, b'nei Yisrael em lo neviim and b'nei neviim, and people that are struggling with mental illness have so much more difficulty. So there definitely is a need of a period of stability. And without that level of stability, you just can't get married. And therefore, I encourage people to be treated. And some people are afraid to be treated because then they will need to disclose things when it comes to shidduchim. But without being treated and without achieving a level of stability, you just can't get married. And I also think it is important to have a supportive family, which is, once again, always important. But to people struggling with mental issues, it is that much more important to have a proper support system, a loving family, a supportive family that knows its role in helping this young couple build a bayis ne'eman b'Yisrael.
Amen. I do believe that the vast majority of people can be successful in getting married and living a happy and a healthy life together with their spouse. However, there are tremendous challenges, and as part of that, I generally will encourage my patients to be as healthy as possible before they'll start the shidduchim process. So one of the questions that oftentimes comes up is, do I have to do that? Do I need to engage in this therapeutic process? Do I need to maintain sobriety for a certain period of time, even if I'm not addicted? Do I need to take all of the medicines the exact way that they're prescribed? And because I'm not here to paskin, rather I'm here to share my thoughts as a treatment provider whose job is to get patients as healthy as possible for the next stages in their life. I'd like to ask the Rav, is there actually a chiyuv to be a treatment adherent individual in order to be at a place where one could get married and bring children into the world?
I think it is a chiyuv to take care of yourself, not only because you are supposed to get married, but because you are supposed to be well. So when the Gemara explains in Bava Kama, and that is loosely translated, giving permission to a doctor to heal. But both the Ramban and Teres Odom and in Shuvas Arashba, they make it very clear, this is not only a permit, it's an obligation. And it is not only that the doctor is obligated to heal, it is the patient's obligation and chiyuv to seek to be healed. And that applies to mental illness as it does the physical illness, and even more so, Because when you have physical illness, in most cases, it would not affect your ability to perform your mitzvahs. But if you struggle with mental illness, it affects your personality, your mental and emotional well-being, and it definitely will diminish your ability to serve HaKadosh Baruch Hu properly. And therefore, if seeking help is a chiyuv, an obligation, in physical illness, even more so in mental illness. So the reason I would say that a person that has struggles is mechuyev, is obliged to follow doctor's instructions, is as compelling in mental illness as in any other illness, and even more so, and at two different levels for two different reasons. Just to be well. To be well, take care of yourself, and to better serve HaKadosh Baruch Hu and your fellow Jew, and to get married. Because lo yitov v'yosodem levado applies to every individual. And we have a mitzvah of prioravia, and therefore, yes, I do think it is mandatory. It is an obligation to people to be treated.
So let's say that a person in Yirtzeh Hashem is healthy and they're prepared to enter into the next stage of their life. Would the shidduch process be different, whereby a person who has struggled with mental health issues in the past might need more time to get to know their potential spouse, their potential spouse's family, that the families might want to make sure that it's not just a shidduch for the kids, but it's also a shidduch between the shvigers and the shverers?
How much time do young people need before they decide we're getting married?
More than 33 seconds, hopefully.
This is some kind of a landmine I don't want to step onto, because the minhagim vary dramatically. You know, in some Hasidic circles and in some Rabbeim's families, you know, the chosana kind of meet once for a half hour, and then they say Mazel Brocha, and they go forward. Other sectors of the Chareidi community, things develop in a more natural way. And a boy and a girl will see each other numerous times. Some would never let them take a walk together or meet in a hotel lobby, only in one's home. And other circles would encourage them to go out. Who is better off? I don't know. Because as I said before, as long as we don't do statistical polls, we would never know. But I believe that if you follow the minig of your forefathers, then you will have siyata d'shmaya. I don't think anybody could prove that the more a boy and girl go out, the better off they are after they get married. But in the vast majority of our community, we do encourage our children to take time and not to feel pressured. And you don't get married before you really feel that this is the boy, this is the girl I want to spend my entire life with. And I think people that have mental or emotional struggles probably would need some more time till they would be confident and we will be confident that they could build a bias ne'eman b'Yisrael. So it would be reasonable to assume that we need to give them more time. And probably, as I said before, because not always are they capable of making the final decision on their own, and they will need the input of a loving family and support of their families.
So for the sake of ensuring that it will be a bias ne'eman b'Yisrael, we're constantly juggling the need to disclose sensitive information about treatment and diagnosis, symptoms, while also hoping that this doesn't break off a shidduch. How does the Rav guide us that we should be most successful in this process of balancing these two potentially diametrically opposed things?
This is a very troubling and a very painful point. On one hand, my halachic opinion, and I expressed this in Shalos Teshuvos Minchas Shosor in the first volume, people ask, what do I need to share with the future spouse? And I say, you need to share anything he or she would want to know. Any relevant information. And relevant information means what your future spouse, as a reasonable person, would want to know. And that is a lot. And who are you to decide what is important for another person to know? But this is becoming a very sensitive and even problematic issue. With every passing day, we know more about our genes. So what do we need to share? If a person isn't well, if he has any illness or medical condition, he definitely needs to share that. But does he need to share genetic issues in the family? BRCA is something that today is very well known. So families would have a much higher risk of developing certain types of cancers down the line. And I say, you don't need to share that. Right here and now, both people are healthy. No one has a guarantee what will happen 20, 30 years down the line. You can have the best genes in the world, and that won't protect you from a car accident or from a thug on the street. And when we're dealing with issues that might become relevant down the line, we hope for Mashiach. We hope for medical breakthroughs. And this will be totally unreasonable that in another few years everybody will need to come to a shidduch with a big folder and start comparing notes. And we will be indirectly implementing Hitler's dream of producing the Obermensch, the Superman, the perfect genetic profile. No. Tomim Tia Im Hashem Elokecha. So let's come back to our more pressing issue. I feel that you need to share whatever is really relevant to another party. On the other hand, we need to give each and every one of our children a fair chance. And if you need to disclose information before the young people even see each other, then many of our children, you're not giving them a chance. And the other family would say, Mali v'letzora zois. I want a perfectly healthy boy. It's also unreasonable that you need to share with a shadchan the most personal, confidential information in the world. Why do I need to share with other people my most private issues, which is my health? And therefore, I think if the other party will say no, I am entitled to the liberty of, if they say no, they should know to whom they're saying no. They should see a face. They should see a person. And therefore, a lot of information does not to be shared only in the process of when a boy and a girl goes out. On the other hand, if you have a real serious medical issue, it would be unwise to just go out on a shidduch and you're just hurting yourself. And once, again and again and again, people will say, no, why are you doing this to yourself? And therefore, we need to find the right balance. Some people, I would lechatchila recommend, turn to a shadchan that specializes in special shidduchim. But if you have a mild issue, then just talk about it with the prospective kala or chosen somewhere down the journey. So we cannot give halachas or psukim. This is a very sensitive issue. Sometimes it would be unwise to look for, quote unquote, a normal shidduch. Sometimes the right approach would be just talk about it. somewhere down the line when things seem to be going in the right direction, and these two young people seem to like each other and consider, sharing their lives together, and at that stage you need to disclose some information. There is no one uniform klal or psak.
I think it's a very good point because, as the Rav started out saying, mental health is such a broad spectrum of specific and very individual situations. There's a massive difference between somebody who's been to therapy for an anxiety disorder and takes a low dose of a very safe, commonly prescribed medication, and somebody who's been hospitalized numerous times for suicidal and violent behaviors. So one of the challenges that I oftentimes find is, again, a very black and white understanding of mental health problems, completely sane, no problems whatsoever, which frankly also isn't fair because, as we know, there are many people who have had challenges with mental illness that are incredible human beings that have grown tremendously through the process. And on the other hand, there are people who don't have a history of mental illness, but
should have.
They either haven't been diagnosed because they've never went, they're incredibly difficult people, or heaven forbid they could develop it in the future. So I oftentimes will find myself saying to young men and women and their families, you're a healthy person. Yes, you've had something in the past, but currently you're quite a healthy person, and you shouldn't be embarrassed to share this with the other side at the appropriate time. So the question, Rebbe, is how can we support the other side to see things in 3D, to realize that there's a greater picture, to not just have a knee-jerk reaction to say no because somebody has been in treatment, is taking a medication.
So this is an educational process. It's not only about the question, what do we say and when do we say? It's a process. And there's an expression in Yiddish, Elebt auf Pillen, loosely translated into Ivrit, Chayal Kadurim, trying to translate into English, living on pills, which is such a stupid expression. But to my dismay, to many people, just the fact that a boy or a girl is taking medication will scare them away. And that is, in so many levels, not justified. As you said, many people having some anxiety, being on medication for quite a while, and stable, are perfectly wonderful, healthy people. And another person maybe should be on the same medication, but he is not because he's afraid it'll hurt him with shidduchim. And if I would need to choose for my daughter which of the two I would like as a husband, I definitely would like the one that is treated and is productive and is a nice person, and not the other one that might be arrogant or aggressive or violent, and he is not treated. So does a person need to tell his prospective kala, I want you to know that I'm an angry person and sometimes I could be nasty and sometimes I might even hit you, but I'll try not to. So no Pesach says, yeah, you need to tell that to the girl you're going out with. But if you take medication and you're doing fine, you need to share that. So there's just something wrong with the attitudes people have. And one of the negative results would be that young people will not be treated, and they will prefer not to be treated because when it comes to shidduchim, I'm going to tell the girl that I'm taking medication, she's going to run away. So I might as well not take medication, and the result will be that this person is not being treated, and he is ill, and he should be treated. So on one hand, I can't give a psak, you don't need to share that you're taking medication, but I would so much hope that people will have the understanding and the intelligence to understand that a boy or a girl that is taking medication and for a reasonable period of time is stable and is well, and according to his doctor, he will be well, and he can be well forever after, then there's no reason to stay away from such a shidduch. So it is a process, and it'll take time, but I do hope that we will be making progress not only in the way we treat people, but also in the way people react and people understand that not everyone that is being treated for a mental condition is sick. And just like so many people are taking some mild medication for heartburn or for a million other physical conditions, the same would be regarding mental health. So we need to change our attitude and our understanding to mental health issues.
Would the Rav recommend that a family that's heard that a prospective bacher or a prospective young woman has a history of treatment, would the Rebbe recommend that they should speak with the treating psychologist, with the treating psychiatrist?
Definitely, and I will also recommend that the people tell their doctor or psychiatrist total transparency and disclosure. I definitely would recommend that, whether it's medicine treating physical conditions or mental conditions. I would say it's the same.
So how can we as the field of mental health professionals, social workers, psychologists, psychiatrists, be most helpful to make these changes within our community and to support not only our patients, their families, and prospective families in Shidduchim, but the community as a whole?
I think that is more the call of Rabbonim and leaders, spiritual leaders of our community. Probably they could have more influence in this area than the professionals themselves. And Rabbonim need to instruct people. We want people to be treated, and a person that is treated is well. And maybe some others that are not treated are not well. And we should take away this stigma of pills. Don't be afraid of pills. Pills don't cause mental illness. Pills treat them. And we should understand that mental illness is a million things, and each of them is different.
HaRav, then how can we as a field be helpful to the Rebbes and to the poskim in order to allow them to make these necessary changes?
I think our generation has made huge progress in the interaction and the cooperation between doctors and Rabbonim. I think not enough in the field of mental illness. But today, first of all, there are so many from doctors. And in the mental field as well. And my dear friend, Dr. Yaacov Freedman, is a very good example. And when we sit here, people seeing this video might wonder, which one of them is the Rav and which one of them is the professional? And when we first met, I thought you were a Rosh Kollel. And my only doubt was, you're not wearing a hat. And a Rosh Kollel would be wearing a black hat or
it's a beard shadel.
Yeah, so Baruch Hashem, I think there is far more trust, mutual trust and understanding between doctors and Rabbonim today than there was in the past. And I expect that to happen, and I hope it'll happen also in the medical field. We have so much to learn from each other, and it is very important that we don't overstep. And Rabbonim, I never give medical advice, never. And when people ask me to give medical advice, I say, I might know a tiny little bit more about medicine than an average Rav, but I'm not a doctor, and I'm not qualified to give medical advice. And I expect doctors to say the same. I am not qualified to give halachic ruling. So we need to cooperate, and this cooperation is so important for the greater good of our communities. And Rabbonim need to understand what a great service therapists, psychologists, psychiatrists are offering our community, and we need to cooperate. And I encourage people to go into the field, because even more than in medicine, when you're a cardiologist or an oncologist or any other field of medicine, it is less important to understand the world of your patient, his ethics, his beliefs, his attitudes, than when you are a psychiatrist or a psychologist. So when you're dealing with the nefesh of a person, it is that much more important to understand the world he is living in than when you're treating his body. His heart is the same heart, whether he's frum or not. I just said such a stupid sentence. His heart is not the same heart, but physically, his heart
It's
muscle,
the same ventricles.
his muscle and the ventricles and the valves are the same. But if you're a therapist, a psychologist, or a psychiatrist, it is that much more important that you understand the world he lives in, his feelings, his emotions, his values, and therefore I think it's so important to have more. And I don't mean to say that if you're a therapist or you're a psychiatrist is not from, you cannot benefit from his treatment. No, I wouldn't say that. But I definitely would say there is that much more added value if you're the one dealing with your mental health really appreciates and understands your concerns, your feelings, your emotions, your beliefs. And therefore, I am happy with the phenomena that more from people are in the field. And I think that our cooperation is so, so important for our communities.
I think that it's a tremendous thing for myself as a psychiatrist to have access to ask questions to the Rav, frankly, to better understand the community and to better understand how to serve specific individuals within the community. So just as the Rav has said, it's so important for there to be more frum therapists. I think it's important for frum therapists to know how important it is for them to maintain strong connections with the Gedolei Yisrael.
So I'm always here for you and for anybody that ever needs my help.
Thank you, Rabbi.